EFT, written by the Centre of Excellence, narrated by Jane Branch.
Centre of Excellence, EFT course, the Emotional Freedom Technique, Part 1. Module 1. What is EFT? EFT stands for the Emotional Freedom Technique. It is a mind-body tool that clears physical and emotional blocks from your energy system, with nothing more than your fingers and intention. It is one of the simplest, fastest ways to heal from almost any kind of trauma, whether it happened yesterday or 50 years ago. EFT is so easy to learn and apply. It is non-invasive, gentle, forgiving, and non-judgmental. It can be adapted to any situation and can be taught to children and adults alike. Although you can take sessions with a therapist who will guide you through the tapping points, it is primarily a self-help tool. Just as the Volkswagen was once called the people's car, EFT has been dubbed the people's technique. EFT has been called many things: emotional acupuncture, emotional first aid, acupuncture without the needles, psychological acupressure, tearless trauma, meridian tapping, or just plain tapping. There are no pills or medication of any sort involved, no invasive procedures, no cutting, prodding, stretching or manipulating. No one has to spend hours talking about their painful past, or go into every excruciating detail of a traumatic event. Tapping can be done anywhere, anytime by anybody, even in one's head if necessary. There are no side effects, just side benefits, and the worst a bit of tapping can do is nothing. Since its introduction in the 1990s, ordinary and professional people all over the world have embraced EFT with a passion and excitement seldom seen in the world of therapy. Housewives, teachers, doctors, dentists, coaches, psychologists, and career sportsmen on every continent have tapped their way into new territories, relieved their pain and anguish, and helped their clients, family and friends do the same. The simplicity of EFT belies its effectiveness and speed. It often works where all other treatments have failed. Whilst results can sometimes take time with EFT, it is absolutely possible to get immediate and long-lasting relief from even serious and intractable problems like phobias and PTSD. The beginnings of EFT actually spring from the frustration of a psychologist trying to treat a severe water phobia. The beginnings of EFT. Roger Callahan was an American clinical psychologist who specialized in anxiety disorders and emotional problems. He had a particularly difficult case with Mary, a patient he'd been treating for 18 months with little success. Mary was terrified of water, not just the water in lakes and swimming pools, but any water. That meant that the simple things most of us take for granted every day, like bathing our children, showering and washing the dishes, were a daily trauma for her. She experienced frequent headaches and nightmares, and had been hopping from therapist to therapist for years, trying to find a solution, but still her phobia persisted. Dr. Callahan tried everything in his conventional toolbox, from hypnosis to cognitive therapy, relaxation therapy, biofeedback, rational emotive therapy, and systematic desensitization. Nothing worked. In fact, the desensitization technique, where Callahan would gradually get Mary to dip her feet in his swimming pool, only gave her a blinding headache and did nothing to quell the rising panic. One day, Mary mentioned that the fear she felt about water was located
Sample complete. Ready to continue?